Welcome to Medical Myths, Legends, and Fairy Tales. I'm your host, Dr. Alan Christensen. Look, you know that between the latest online fads and the crazy media headlines, it's easier than ever to get confused about your health. And you and I just want to feel better and live longer. We want to know what works. And we can't wait for further studies. We need to make decisions today based on the best evidence we've got. Well, that's exactly what this show is here for. So let's get to it.
Hi there, this is Dr. Linda Koshaba from Integrative Health. Would you like some help with your thyroid? We would absolutely love to help you out. And guess what? We can even do remote care. Please call us today at 480-657-0003 to set up your first appointment. If you mention code podcast20, you will get 20% off from your first visit. That phone number again is 480-657-0003, and the code is podcast20. Can't wait to meet you.
Hey, Dr. C here with you. Welcome to a special COVID-focused episode of Medical Myths, Legends, and Fairy Tales. For this one, I wanted to pull in my friend Dr. Susan Wilder, and I wanted her input because she's been active with the Arizona legislature and the governor, pushing them to be a little more aggressive about things. But she's got some great insights from her background working as a physician in the Air Force and also with current first-line private practice during the pandemic. Dr. Wilder is the founder of Lifescape Premier. She first trained in family medicine in the Air Force, where she served as assistant chairman of family medicine at Andrews Air Force Base. After her military time, Dr. Wilder moved to Arizona, where she founded the Mayo Clinic's family medicine residency. She's also certified in functional medicine and lots of strong backgrounds in meditation, mindfulness, motivation. So great gal, good insights, and hope you enjoy the conversation. Hey, Dr. C with you, and joining today with one of my favorite people, Dr. Susan Wilder. I'm really glad to have her with a personal friend, the person who does my annual oil change and and someone I've kind of really have a close friendship with. A couple of decades we've been friends and talking and thinking these things through. And, someone I really respect in terms of just having a sense and understanding, deep understanding of natural medicine, but well-grounded in the conventional world, experienced in their time in the military, and on the front lines of patient care. So, yeah, Susan, how you been doing these days? How are things going for you?
It's been going as well as it can be. As one of our senators commented to me recently after I've been beating my head against administration since January, saying, where's our testing? Where's our protective equipment? Where's our stand in place, shelter in place orders? Why are we failing at every single measure we could have to contain this virus? And she said to me, sometimes, as we did in the military, you just go to war with the army you got. And I said, yeah, that's pretty sad with the current, with the resources you'd think we could bring to bear from this country and having years of forewarning and months of notice. We've kind of failed on every count of delivering a testing strategy that was working and timely and available to everyone, and delivering just even basic protective equipment for our frontline personnel and first responders. I just feel like we've failed on so many counts. So the only thing we have left is how we take care of ourselves. And, I think, fortunately your practice and mine, our patients have listened and have heard us and are already doing everything that we've taught over the decades to optimize our own health and get our immune systems in order. But and that's a silver lining in all of this too, is this pandemic, I think, is, one, it hits the pause button on our overly crazed and overscheduled lives and forces us to take a step back and pay attention to what's most important. And I think it forces people to really treasure their health, that health we just don't, the things we take for granted until we don't have it. So, I think there's a great opportunity here.
Are you still practicing telemedicine or in person, or what's your status right now?
Yes, all of the above. Well, we've been doing telemedicine all along, so we always offer telemedicine. We've always offered telemedicine capabilities for anything that didn't require coming into the clinic, and then over the last several weeks, ratcheted down to very skeleton crew in the office, and only here seeing those patients that we absolutely need to see, that we need to do an evaluation. I evaluated a patient in the parking lot this morning. If we can keep our high risk patients out of the clinic, and we want to keep people as safe as possible, but yet we want to keep taking care of them.
Yeah. What are some of the biggest misconceptions that you're seeing from patients, those you're interacting with? What are some of the biggest ideas that you think would serve people to not hold on to or to see differently?
I mean, the biggest really scary misconception are that there are still people out there that are preaching that this is just a big hoax and it's being overplayed. And that one of my best friend in California got reamed out the other day in line at the grocery counter, where she was checking out and just thanked the cashier for being there and working in a high-risk situation. Oh. And the woman behind my friend in line just reamed her out and said, "This is just a giant hoax, and I cough on everybody here." And it was I would have had her arrested, I think, if I had been there. But and we've had unfortunately, for a very long time, I think patients were getting a lot of false reassurances from various, leaders, and I'm not going to go further than that. That's fine. Probably an overstatement, but those false reassurances put hundreds of thousands of people in danger. I think people don't understand what an exponential progression looks like, where, we don't know for sure what they are, not, the infectiousness of this virus is, other than it is far more infectious than influenza, and the importance of staying home. But I had patients traveling even a few weeks ago because, quote unquote, "Well, there are no cases in New Mexico, right?"
Oh, no.
And I said, "Oh, no, there are no cases because we haven't been testing. We haven't been able to test." And now we've been very aggressive in seeking out labs to do antibody testing, COVID antibody testing. And we are picking up a number of people who are acutely infected and have no symptoms. So, high-risk patients or people who are contacts of high-risk patients, or healthcare workers who are coming up IgM positive for COVID-19 antibodies, and didn't know that they were spreading this potentially. So, that's a powerful.
We've been talking about this lately. I love your insight and your thoughts, but there's been early along, a lot of the public health messages talked about the asymptomatic carriers. And now they're talking about it again, but they're using a different context. And I wish they would have had two terms. I wish they would have talked about pre-symptomatic and asymptomatic, because they're really different things. So before, they were talking about people who were really pre-symptomatic. They felt fine, but they weren't going to forever. They were going to get something sometime in the coming days. But now, like you're saying, we're learning many people will be long-term asymptomatic. They're probably never going to get symptoms.
Right. So, yeah, I mean, the countries that did a much more robust and effective testing strategy, where they tested anyone who wanted to be tested. Iceland, for example, was very aggressive in their testing and found, I believe it was somewhere between 25 and 50% asymptomatic positive COVID, that's PCR, nasal swab. And that's, I don't know what percentage of those asymptomatic patients went on to develop symptoms or just were young. Young adults and children get this infection just as often as older people, but their symptoms are so mild. And that's what has many people, that's why this virus is so terrifying, is because, unlike SARS, which made people very sick very quickly and killed them very quickly. So, it was very inefficient at, proliferating among the masses. This one is a lot more stealth and able to be spread very widely. And, and then people start getting sick days into infection. And the illness is a little bit of a weird, is a different course in every patient, it seems like, where a lot of people have kind of mild, vague symptoms or a little bit up and down, and then boom, crash and burn, incredibly sick in a hurry.
And I've heard many say that comes on when they feel like they're through it. They feel like they're on the mend.
Right. Yeah. No premature gloating on this one, man. We've seen patients who are still, quite really battling 2 to 3 weeks out.
And the next question too will be how this affects people afterward. What are the follow-up consequences, and how do things go that way? And you probably heard some more as well, but I've heard some that had this early along that this has really laid them out and affected them strongly in ways that seem to be, so far, they've not yet really bounced back from.
I think one of the biggest, there are so many questions. Again, this is brand new. None of us before December of 2019, no one on Earth had any familiarity with this virus. And I think a lot remains to be understood. And I think there is too little being said out there, I think, where you have the opportunity, and the naturopathic community, an integrative community has the responsibility of really paying attention to what is the health of that person before they were hit with this. Mm-hmm. We've got over 80% of the American public is metabolically unhealthy, right? Yeah. I mean, the numbers better than I, but that is, we have so many things that have set up our population to be immune impaired and not know it, right? Yeah. And then how does that affect the immune response to this, which, is either a problem of under response or over response, right? It's the accelerator brake problem where, we have, I think a lot of people are dying from that cytokine storm, that inflammatory over response. And it makes me sad because it makes me sad that, and happy that about our collaboration, but sad that in the hospitals yet we don't have naturopaths and functional physicians and integrative physicians really as part of the inpatient treatment team. If I'm in the hospital, I want you or, a doctor like you as part of my treatment team, advising on some of the nutraceutical immune modulating interventions that could be used in complement to the pharmaceuticals, which right now are coming up short.
Yeah. And I've been somewhat pleasantly surprised to see so many acute care ER doctors and the researchers in those worlds say, yeah, what could work? What can we give vitamin C? Can we give glutathione? And not really having big biases about what's going to be effective, but just pulling out all the stops and thinking things that have some plausible mechanism of action. So that's been encouraging.
I mean, I am hearing it in New York, but it's kind of hit or miss. I mean, I would love to see it much more integrated into this. I still go visit patients in the hospital and they're being fed Jello after surgery or ginger ale or, God, you're like, oh my God, what the heck are you doing? You're just poisoning this patient at their sickest point. So you wonder why we don't do so well. So I think that health of the person prior to infection has a lot to determining their long-term outcome and whether they end up in fibrosis and with long-term lung disease. I know the SARS outcomes, the survivors definitely had some long-term, definitely cardiac and pulmonary issues. So.
One of the big implications I realized was that you were talking about the 80% of us being metabolically challenged. And yeah, I've seen numbers pretty much just like that in terms of just our weight not being where we want, or our body composition not being where we want, or our blood sugar regulation, that these are amongst the larger risk factors. And yeah, that's so much of our population. So I told the audience actually today in a big post that came out, I said, look, I hope you don't get sick, but in terms of what will stop this, we've got herd immunity, antivirals, and vaccines. And I'm all for everything. I'm guessing herd immunity is going to be the first of those. I don't see the others being all that quick, So
right.
I think the odds are it's going to be herd immunity, which means most people will get sick. So try not to get sick. Know that you probably will get sick. And so what are the main complications? So this is time for going on a health kick. This is time to drop those pounds and do whatever you need to do.
Exactly. Well, that's why I said it's a silver lining. It's a golden opportunity to, get your health in gear and to really, really pay attention. Because I think that's what's going to really determine, when we look at the numbers of hospitalizations, the admissions, the severity index for younger patients in the United States is much worse than it was in China. Now, we don't know, the epidemiology of behind that has to be ferreted out, but, is it vaping? Is it diet? Obesity, diabetes, right? Is it sleep and stress and lack of exercise? Is it all of the above? Probably is some constellation of all of the above. But, as we said, and I think one of our former podcasts, we are not a healthy population by any stretch, but it doesn't take much. And we can get healthy pretty quickly if we really put our minds to it. And so hopefully this is sparking some motivation that maybe wasn't there before, and taking away a lot of easy bad habits that we're not able to go to the movies and eat a huge thing of popcorn right now, or whatever. Go out with friends and drink too much, or whatever bad habit we might have been indulging in a little bit too regularly.
Well, I don't have time to cook. I don't have time to exercise. Well, now we do.
Now I got plenty. Right.
No real options otherwise.
Right.
We'll be right back after word from Integrative Health.
We hope you are enjoying this episode of Medical Myths, Legends, and Fairy Tales. This is Dr. Turner at Integrative Healthcare. So often we hear from our new patients that their primary care physician has told them that their thyroid and hormone levels are fine, and they should not worry. Yet the patients still have symptoms of severe fatigue, thinning hair, and weight issues. Unfortunately, this is too common with thyroid care. The good news is we can help, and there is hope. The doctors at Integrative Health, including myself, specialize in naturally treating thyroid, hormone, and adrenal issues. We would love to get you started on the path to ideal health. From the comfort of your own home, you can get treatment with one of the doctors at Integrative Health via telemedicine. Go to integrativehealthcare.com to become a new patient today. Use code PODCAST20 for 20% off your new patient visit. Again, that is integrativehealthcare.com, and use code PODCAST20. Get back on the road to thriving.
And now, back for more medical myths, legends, and fairy tales. So what are your thoughts about the idea of the next wave, the coming months? What is your crystal ball telling you these days? I'm sure you got the batteries on in that thing, right?
Oh, gosh. Yeah. I tell people this is a marathon, not a sprint. Look at the 1918 influenza pandemic as a very close approximation to not only how infectious this bug is, but how lethal. I think at the end of the day, the mortality will come out fairly close. And boy, that killed a lot of people. Big chunk of the globe's population. So, believe me, as much as I have harped on our legislators and governor about being much more aggressive about shutting things down, and because people were not getting the memo. They just were not getting the memo. But, I think, the more we talk about it, the more we realize that, the more we talk about it, the more we realize that, the more we talk about it, the more we realize that, 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 the I don't want to be the one that has to make that decision of when you start to lift things, because I also look at the economic and the emotional, mental health impact.
You can't ignore these things. They're real.
So you're balancing some really, really tough decisions. And I totally get that. I think what we will see, we really have to hunker down for a good 4 to 5 weeks to really flatten that curve and hopefully keep our healthcare system from being overwhelmed. Like, the situation in New York and Italy, which just, you cannot watch some of these videos or talk to some of these doctors without just being in tears, where they're sitting there having to decide between their colleague and, somebody else who's 40 something, who gets the ventilator and who dies. And by the way, you end up on a ventilator, your likelihood of survival is somewhere less than 50% probably. Even if you got to that point. So really, some horrific stuff that we hope to stave off. But I think that we're going to have to watch these other countries, like what happens in China as they lift restrictions, what happened in Italy. Do they see a next wave, which we will until there is substantial herd immunity. With our antibody testing, I've counseled a few people who are IgM antibody positive. They are infected acutely and need to isolate, and of course it's a shock. It's a shock to them. But I said, on the positive side of this, as we help you manage through these symptoms, you will be one of the people who could breathe a little bit easier. I can't tell you how strong that immunity is going to be or how lasting that immunity is going to be, but you will be one of the people who has a defense, whereas the rest of us have none, and it's going to be, we have not ever been successful with a coronavirus vaccine. So much as I'm, hopeful about the technology and at the speed at which they're able to even get these to clinical trials, one of the downsides with every coronavirus vaccine that's been tried so far is the risk of this overactive immune response that kills people. So I think there's a lot that the naturopathic community and functional medicine community could really bring to play with the allopathic community to help modulate that. If you combine that antibody with 2 weeks of, nutritional support and dietary regulations or whatever, a dietary program that just helps get people in a healthy immune state. It's how we feel about vaccinating all the time. I don't like to vaccinate anyone who's, I call an inflammatory mess. And that's a lot of people out there. But once we get you to not inflammatory mess standpoint, that may be a point where certainly the benefits of vaccine might outweigh the risks.
Sure.
But we're not, as we roll this out, it's not going to be, we're not going to be selective in who it's being offered to. And I'm a little worried about, the downsides, and then throwing out the baby with the bathwater and deciding, this is too dangerous, when really it just required better advanced preparation of that patient, a little bit more proactive planning or better patient selection, before you inflict a vaccine on them.
And a funny thing I've been realizing too is that for so long, we've had conversations about me bemoaning elements of natural medicine not using higher evidence when it's available. And right now, we can do it with whatever scraps of inference and conjecture we have. And we should, we have to do our best to have conjecture and have some thoughts in the absence of any other data. So it's almost reversing a lot of the evidence-based directions we've been trying to move in.
Well, and how about all of our over-clean issues? I'm like, oh my God, my microbiome is really taking a hit with this, but I gotta.
I've not heard this. And But I'm sure there's some relevance. You wrote the microbial cloud. You were walking around clouds, so to speak. It's not just our gut; it's everywhere, and it's even like it's extending from us. But what are the effects of the diversity and the robustness when we're not around other people? At some point, that's almost like being in too clean of an environment when we're being this deliberate. We need to, and I don't begrudge any of it. But somewhere along the way, that could theoretically have negative effects upon our resilience.
Yeah, exactly. And beyond just emotional, mental part of it. And, I really feel for the people who are having to homeschool a bunch of children. So glad I'm not in that boat. I would have needed a lot of duct tape and, I don't know, a lot of wine, I think. But, I think... there are implications to everything everything we do has a potential for benefit, potential for harm. There's no one size fits all. We're all a clinical trial with an N of one. And it is a big science project, and we're trying to, help our patients understand that, because, people want black and white. Do I have it? Do I not? Well, no, you have positive antibodies. Now, yes, there could be cross-reaction with other coronaviruses that have similar antigens. I can't say with 100% certainty any test is perfect. Every single test has its benefits and potential harms,
What is something that when you tell people as you're counseling right now that they're most surprised about? What's something you think is an important message that people are not really hearing? Not even like a misconception per se, but just something that's critical that, like, oh, wow, I didn't really catch that from the media, or I've not really heard that elsewhere. What's like the most surprising, unexpected thing you think that you deliver to people?
I think people are most surprised that I'm not saying here's A, B, C, D, E supplements that you need, that everybody should take. I think they want a pat answer. Oh, if I do saline rinses umpteen times a day, and I do this kind of gargle, and I do that and the other thing, that's going to protect me. And I think it most surprises people when you say none of that is proven. It's proven. Now, if it's not going to hurt and it's not going to consume your life and make you crazy or what have you, then certainly there are some of those things that I'm okay with. But, I think people want more black and white. They want something that they can do that they know is going to work. Well, this is all an unknown. We are all treading in uncharted territory. I think people are also surprised at the confusing reports of don't wear a mask, it's not protective, maybe it's a little protective, and again, I understand where the CDC is coming from in changing that guidance. I think it's probably not very helpful and potentially harmful to say, a study just came out of South Korea where they had COVID positive patients cough through 4 different masks into a petri dish. And they tested the petri dish, the outside of the mask, and the inside of the mask for presence of the COVID-19 virus. And every one of the masks failed except for the N95 mask. And the surgical mask, interestingly, failed. So that was the one we thought would be the most likely to protect the rest of us from somebody positive walking around and potentially coughing in a grocery store or what have you. Surgical mask not only failed, it had more virus particles on the outside of the mask than the inside after a COVID positive patient coughed into it. So for an actively coughing patient, they ought to stay home, and the masks, might actually make people, kind of give a false sense of reassurance. Plus, I don't know about you, but, we're wearing masks to, see our patients and I'm touching my face 89 times. And every time you touch that mask, you have contaminated it. And we don't have the supplies to replenish them. We don't have the easy ways, at least in the outpatient setting, to sanitize them. I know of docs in the hospital that have had to use the same mask day after day. or patients, when they're hospitalized, get very upset because the staff aren't coming to see them very often. And I'm like, you have to understand, they can't. Every time they come into your room, they have to change out gear that they can't afford to change out. So, you know what? Even if you're in the hospital, you're going to be, kind of in a telemedicine isolation room situation where they're monitoring you, but they can't be in and out of your room, attending to you the way you normally expect.
And then in terms of just yourself, your family, those you're talking to, what's like one top tip you could leave us with for trying to stay sane right now? Like, what's kind of, maybe a comfort for you?
I think, our basic thing is, number one is practice what we preach about, eating very healthy, whole plant-based diets. I've been really thrilled with, some of the farmers markets and local farms that do a box, you can order a box of fresh organic produce and literally drive through, and they plunk it in your trunk and you're good to go. So, support our local farms that way. And for me, the number one sanity protector has been the Calm app, daily meditation, mindfulness, a walking, mindful meditation we are so blessed to be in Arizona, where it is so beautiful. Everything is blooming, get out in nature, get a little sunshine, and do some, deep, gratitude-based, abundance-based meditation, because I think that helps really keep you in a positive focus. Also, one of my little tips is I found that 20 seconds of hand washing for me is exactly 3 deep breaths. So 3 deep breaths, 3 things I'm grateful for every time I'm washing my hands is, it's a good little mini habit to hopefully that I'll carry on forever.
I guess last thing. So what's the first thing you want to do when things let up? Back to some level of normalcy.
Just go out to brunch with my daughter, or, breakfast with my daughter, and go out to dinner and a movie with my husband, and get and be able to see our patients. It's okay to kind of do these video telemedicine and that kind of thing, but it's really hard for extroverts, I think, to just not have that personal contact. I don't know, how you deal with it, but and I'm a hugger, I have to catch myself from just, not invading somebody's personal space. So
I wonder if those mores and norms will shift in our culture. If those things will be different.
Because I think this virus is going to be around for a while. I think they'll have to. I think that it's not going to go away like SARS did in 8 months. It's going to be around for a few years until, as you said, herd immunity or a vaccine that's effective and able to be deployed widely enough.
Dr. Susan Wilder, this has been awesome to have a little slice of your time. It's super valuable right now. I appreciate that. Lifescape Medical, what's the best place for someone to connect with you further to see more about your work?
Sure. It's lifescapepremier.com is our website, or you can check out Brilliant Health Community on Facebook, or Lifescape Premier on Facebook. And we're doing every Friday a Facebook Live Q&A to, just answer questions and, the things that are coming up in the news, and what's the latest on hydroxychloroquine, which if I get another hydroxychloroquine question, I don't know.
We just don't know, right?
Oh gosh, it's just irresponsible to be putting these things out there as if they're, absolutes, when there's so many more questions than answers yet. As I always say, look, when Fauci's on, turn up the volume. When anybody else is on, mute,
That's a good tip.
Yeah, general. Yeah, just listen to the doctors, and not necessarily Dr. Oz. No offense, but listen to the doctors who don't have a stake in this. Who really have your own interests as their only interests.
Dr. Wilder, thanks again. Always a pleasure to get to see you, and I look forward to connecting on the other side here.
All right, thank you.
Hey, Dr. Christensen here. Thanks so much for joining me for another episode. Is there a topic you'd like me to cover? I'd love to hear from you. Just go to Dr. Alan Christensen on Facebook or Instagram, write your question, and use the hashtag #MedicalMyths. Did you find this show helpful? If so, please take a minute and leave us a rating on iTunes so that others can know. Thanks much, and I'll be back with you real soon. Bye-bye.